Researchers at Oxford University may deliberately expose people to the coronavirus as part of the third and final phase of their vaccine trials. NBC News chief foreign correspondent Richard Engel explains why they might take that controversial route.
Here in the UK, scientists at Oxford are calling for so-called human challenge trials. Large numbers of volunteers, anywhere from 1,000 to 10,000, sign up to get an experimental vaccine. Half of the group gets the experimental vaccine. The other group gets a placebo, something that is not the experimental vaccine. And then both groups are told to live their lives normally. But because in many cases where these people are living, there are not wide-scale infection rates, very few people who have been given the actual trial vaccine come into contact with the coronavirus. And that's really what the scientists want to know. Does the vaccine work in real-world conditions? Human challenge trials would be very different. Instead, you would take a much smaller group, 40, 50, 60 people. You would give them all the vaccine candidate, and then you would give all of them deliberately a dose of the coronavirus. And then scientists would watch. And then, in this case, they would have a 100% pool to examine. And already 30,000 people in many countries have volunteered. I spoke to one of the organizers from a group called One Day Sooner that is helping to collect the samples. And one of the issues you raised, the ethical questions. Can you deliberately infect someone with a pathogen when currently there is no known effective treatment, no known effective cure, and to which there might be long-term health effects that are still not completely understood? They recognize the dangers, but say that right now we are in a period of an international crisis. After all, soldiers raise their hand and go off to war. So they are looking for brave volunteers, and they're getting quite a few of them. So this is part of the conversation I had with the volunteer from the organizer from One Day Forward. Is there any precedent in history of doing this? I know there have been challenge trials in the past, but challenge trials on this scale with really no rescue drug.
No, not on this scale. Certainly not in this scenario. I mean, we haven't lived through anything like this in my lifetime, nor in yours. And I think one thing to sort of recognize is, yes, like this would be a deviation from precedent. It's why it's so important that we're having these conversations about ethical considerations, about logistical considerations, planning and talking, engaging the public and communities, because this might happen again. You know, this might not be the only significant pandemic that we face, and you want to make sure that any action that you're taking, anything that you're implementing, is a precedent that you would be happy for people in the future to follow.
Norway on high alert after at least 53 people on a cruise ship tested positive for COVID-19. That outbreak reviving conversations and questions about whether Europe opened back up too quickly. NBC News global correspondent Tessa Arcilia has the latest.
Well, just as the cruise industry is restarting its engines, quite literally, there are new reports of outbreaks on ships. The most recent one in Norway on the MS Roald Amundsen. 16 passengers and 37 crew members so far have tested positive for COVID-19 after they were allowed to disembark in the Norwegian town of Tromsø. Well, there are fears that there are more infections in towns and villages where the ship had sailed from port to port. The Norwegian government announced that it is not going to allow ships with more than 100 people from disembarking passengers in the next 14 days. Well, we spoke to the mayor of Tromsø, and he thinks that Europe had opened up again a little too early. Take a listen.
I think we have to be prepared when we open the society. It's a little bit danger for the rise of the virus again. A lot of governments around Europe open up. We have to open up in Norway too. And now we can see it maybe too early. Maybe we should wait after the holidays.
Well, it's a bit of a stop and start situation in Europe, just like with opening borders and resuming summer travel. As restrictions ease, we see some rise in infection cases again in some places. Well, the U.S. is taking on a harder stance when it comes to the cruise industry. There is a U.S. ban on cruise ships until the end of September. The Center for Disease Control and Prevention say that cruise ships are more crowded than urban settings and that the industry had not managed to contain transmissions on board. Now, at the height of the pandemic, there were more than 50 ships that reported outbreaks, thousands of passengers stranded on board. So right now, just like airports, there will be new rules. There are already new rules in place on ships. Now, we also spoke to some of the people who were on that Norwegian ship, and they say, well, they're not really put off, that they will still go on cruise holidays in the future. So that's a bit of a silver lining for an industry experiencing yet another setback.
A Florida teachers union heading to court to try and stop the governor from bringing them back to the classroom. NBC News correspondent Sam Brock reports from Miami.
Allison, good afternoon. Good to be with you. There is a state of flux right now in Florida when it comes to kids going back into the classroom. The Florida Education Association suing the state right now. That's the largest educational union, really labor union in the entire Southeast, telling the state they've got to pump the brakes right now on an emergency order that would require all school districts, there are 65 of them in Florida, to have a brick and mortar in-person option when schools reopen. And for some parts of the state, that is on Monday. What happened today is they've decided to move the location of where this matter will be resolved from Miami, where I am, to the state capital of Tallahassee. But they have not determined yet when the merits of this possible injunction are actually going to be heard, and time is running out on that front. Now, for context, there are 25,000 kids under the age of 18 in Florida that contracted COVID-19 in the last month over July. That's 800 a single day. Compare this to what's going on in other school districts in the country. New York City right now trying to figure out what it's going to do with a 1% positivity rate at the moment. Chicago, the third largest school system in the country, they decided to pull the plug on any sort of in-person teaching and go completely to online. They have 400,000 students in that school district and a 5% positivity rate there. In Florida, where I am, 11% positivity yesterday. That dipped a little bit down to 8. It's the first time we've seen it that low in weeks here. Those were the latest numbers, but it's been consistently around 10 or 11, at least double what some of these other cities are looking at, and still it's full speed ahead at the moment. We talked to Frederick Ingram, who is the president of the FEA, suing the state right now. He talked about why he's so concerned.
We don't know if these schools are going to be safe. We don't know if we can keep our students healthy. We don't know how many people are going to die. But what we can do is do everything that we can to protect our students, to protect our teachers, to protect our cafeteria workers and bus drivers and paraprofessionals.
An attorney for Governor DeSantis and the Florida Board of Education did address some of these matters today in court, talked about the fact that of those 65 school districts throughout the state, all of them have an option to submit a plan that would allow for either partial or complete online learning. So that's what the state is saying, but there's variability right now. We know in Miami-Dade, they are in fact starting their school year this year online, but that's not the case across the state. So tremendous amounts of concern there. And then on top of that, we've seen what's already happened in Georgia and Mississippi within the first week or week and a half of classes opening in person. In Georgia, within 72 hours, 3 students tested positive for COVID-19, another teacher exhibiting symptoms. And in Mississippi, there have already been 6 positive tests among students in one school district, with 100 students quarantined so far. That's just within the first few days. So obviously, examples across the country and in the Southeast right now playing a role here in Florida. We'll see what the next legal step might be. In Miami, Sam Brock, NBC News. Back to you.
President Trump says we could see a coronavirus vaccine by November, but Dr. Fauci says not so fast.
We're trying very hard to ultimately get a vaccine that might be available by the end of the year or the beginning of 2021. But that's many months away.
Joining me now, Dr. Julie Morita, Vice President of the Robert Wood Johnson Foundation and former Chief Medical Officer of Chicago's Department of Public Health. Dr. Morita, thank you so much for being with us. Where are we in the search for a vaccine?
I mean, it's really incredible. It's unprecedented speed in which we've been working to create a new vaccine. There's a number of vaccines that are in clinical trials. So about 30 vaccines are actually in either phase 1, 2, or 3 clinical trials. And that's really unprecedented in terms of a new virus emerging and then having a vaccines at this level already.
Let's talk about distribution, some Americans are at greater risk of contracting the coronavirus than others. Who gets the vaccine first? How are things like that decided?
So I think it's really important to look at past history. We've had some other pandemics not so long ago. So in 2009, there was a H1N1 influenza pandemic. And at that time, there was a shortage of vaccine, or vaccine was trickling out. And so not everybody who wanted it could actually get the vaccine. Prior to the vaccine actually being available, there were steps that were made to actually determine who was at highest risk for disease. The data were reviewed. Great groups of folks, including academics, ethicists, scientists, vaccine people, all kinds of healthcare providers came together and came up with a prioritization, looking at people who are at highest risk for getting disease, and also considering people who might be essential services. So we really want to make sure people like healthcare providers were actually able to get the vaccine early on. So the same thing is happening as we speak right now. There are considerations for who's at highest risk for disease, who is considered essential services, so that we can actually prioritize those folks who need the vaccine most to get it early on when the supply is shorter.
400 public health experts sent a letter to the FDA demanding a transparent vaccine approval process to build trust. What would they like to see here?
I think the key thing to keep in mind is that, we have vaccines routinely recommended. There's over 17 vaccines that are actually recommended through the lifetime for people to receive. And there are established systems for developing vaccines, testing vaccines, making sure that they're safe, they provide good immune responses, that they prevent diseases. Those systems are all in place. And there's also systems to actually review the data to make sure that when a vaccine is actually recommended, that it's safe for individuals to receive it and will actually work. That letter from the 400 scientists actually was promoting the use of and recommending that this process be used, that these established systems be tapped into, so that the public can have confidence in the vaccines. The vaccines are being made at faster speeds than they have been in the past. And so it's really important that we use the appropriate steps to make sure they're safe and they're effective, so that the public can have confidence and feel comfortable getting the vaccine.
Dr. Morita, you're also a pediatrician, so I'd like to get your take on school reopenings. A recent study out of South Korea found that asymptomatic people are just as capable of spreading this virus. So what does that mean for teachers and kids who may be heading back to the classroom?
I think this is a critical juncture for us right now. Kids are heading back to school. Some schools have already started. And as a pediatrician, as a mom, as a public health person, I'm really concerned about this. And I think we have to do this safely. Schools are important, and education is important from a learning perspective and also from a social emotional perspective. But it has to be done safely, so that in communities where there is widespread disease, things should be evaluated very carefully. It's possible that opening schools is not the best idea. And so really looking at what's happening within the community to understand how much disease is going on there is really important. We know that children themselves may not get seriously ill or as seriously ill as older people or people with underlying conditions. And yet we know that children don't live in bubbles and that they actually are interacting with adults, their grandparents, their aunts, their uncles, their parents. And some of those folks may be older, some of those folks may have underlying health conditions. And it's really important for us to think about those risks and those ramifications of reopening schools when there's widespread disease that's going on.
Dr. Morita, thank you so much for taking the time to be with us today and for your expertise. We appreciate it.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.